today. We're expecting quite a number of faculty and staff and students on the Research Town Hall today. I know they're still coming on board, but we have around 550 now, and we're probably expecting another 200. But we have a lot to cover today, so I would rather not delay. And first and foremost, I want to thank everyone for joining us. This is an opportunity for us to really know and fully understand what we're trying to do as we slowly ramp research up on campus. And to understand this in the broader context, we have the good fortune today to have our Chancellor, Pradeep Khosla, to say a few words as we open the meeting today. So Pradeep, would you like to open?
Thank you, Sandy, and welcome everybody. And thank you for being on this call. And I can only imagine that the interest in getting back to campus and getting a research going must be extremely significant, because I have never seen so many people on a Zoom call. I did not realize Zoom had the ability to manage like 700 people. Anyway, I'm glad to be here. This is, if you've been counting like I have, we are going beyond 10 weeks of shelter in place, a lockdown on campus. And while the decision to make shut down the campus was relatively easy and relatively swift, the decision to reopen the campus is much more complicated, much more deliberate, and much slower than one would expect. But in these 10 weeks, I want to say thank you to each and every one of you. Everybody has had a very significant role to play in the smoothness with which we've transitioned from fully operational to lockdown to fully remote. And I think I'm hoping that we have the same level of cooperation and smoothness in reopening our campus. So reopening is going to go through multiple phases, but the real trigger for all of this was this Return to Learn initiative, which is not just about coming back to take classes, it's return to learn and equate learn to the university. And this was an initiative that a couple of my colleagues, Chip Schooley, who's here, Natasha Martin, and Cheryl Anderson, helped lead to define what is the most scientifically informed way to bring back people to work in a manner that is safe and that is deliberate, and in a manner that we are not just accelerating the process for the sake of accelerating. So we are 2 weeks into this first pilot program, for our first pilot test, where we tested only students on campus. And I think we've tested about 1,200, and Chip can chime in later, and we had 0 positives. So the great news is that we are 0 positives, but if we have no positives, we have difficulty in exercising our strategy for tracing and tracking and doing a whole bunch of other secondary things that we have to do to make this a composite, a whole program. So on one hand, I'm really glad that we had 0 positives. On the other hand, we still have not completely tested all parts of this program. Part of this return to learn is now, the next phase is going to be return to research. The phase after that is bringing faculty and staff back to campus. So there are multiple phases of this, multiple committees are looking at it. And I can tell you, the Emergency Operations Center, led by me, literally thrice a week spends an hour, hour and a half, just talking about all the issues. Things are going relatively smoothly. If you have any questions, you should feel free to send an email to eoc@ucsd.edu. And we'll be happy to direct your questions to the right people who are representing each and every one of our functions on the EOC. I'm going to stop here because I know the agenda is very tight and the agenda is heavy, and you all want to hear what is the process by which you're going to come back in terms of return to for starting your research programs. And I can tell you, our VCR, Sandy Brown, has done an amazing job. She's led an amazing team. You will see a very comprehensive program out there. Just like anything else in science or engineering, you can always find a hole or two, but that's not because of lack of attention. It's mainly because it's such a complex process, and one has to run the experiment before one can figure out all the holes and how they should be plugged, right? So hang in there with us, and thank you very much for being here. Sandy, if there's time, I'm happy to answer a question or two, but your call.
Actually, if anyone does have a question for the Chancellor before we get into the specifics, this is a great time to ask.
Okay. What is your confidence level that the return to learn swabbing has been done correctly, given that there are no positives? Clearly with all of these, the confidence level can be no greater than the sensitivity of the test. So has the swabbing been done correctly? I'm about to say yes, but remember, I'm not a doctor, but I do have a doctor, Dr. Chip Schooley, our infectious disease expert, who might want to opine on this. Chip, do you want to say something about this?
Sure. We think the students did the swabbing properly. We'd have been frankly surprised if we'd had more than one or two positives in this group. These are students who've been sequestered in the dorm since the outbreak. And our effort here was more to test the feasibility of doing this mass at-site, on-site testing without kind of the medical model. And that part was successful.
Right.
We're pretty convinced the swabbing was done well. We'd have to have a higher incidence population to be able to know about the positive aspect of this.
And also, if I may add, so I think, if I'm not mistaken, we've done close to like 4,000 or maybe a bit more tests on our hospital workers, and only 2 have been positive. So the incidence rate here has been extremely low compared to the averages. And what I'm told is that the real hotspots are deep south near the border, and north of us, the incidence rate is very low. Chip, would that be a correct assessment? I mean, I know you keep track of these things. So.
No, that's exactly right. Our current kind of around UC San Diego prevalence rate, we think is quite low. I'm going to present a little bit of that in a few minutes when we talk about epidemiology.
So the question is, have there been any savings related to energy costs from the large reduction in on-site activities? The short answer, I think, is yes, but don't ask me to quantify. But I can tell you the most significant answer is the level of pollution that has gone down because of fewer cars on the road. And now we are seeing pictures, not just in San Diego, but in LA, where you can see downtown from like 30 miles away, which you could not see like 3 months ago.
Very good. Well, thank you so much, Chancellor Kerzler. I think there are a few other questions which we're tracking, and they relate specifically to the return to research, and we'll talk about those a little bit later. But okay. I so appreciate you joining us and sharing with all the faculty and staff and students that are on board the exciting progress that we're making here in San Diego, actually pioneering progress. Yeah. There is no other campus in the country that has a return to learn program that is as comprehensive as ours is, and you're to be congratulated on that.
No, you are, Sandy, and you've done an amazing job and your team, and Chip, you and your team. And I have to say, all the faculty, were it not for the great high caliber faculty we have, it would not be this easy. And in case you guys are watching TV, today, Chip and Kim Prather's paper is being discussed on CNN, if I'm not mistaken, so on masking, so. Wearing masks. All right. Thanks,
fantastic.
Everybody.
Thank you. Thank you. And speaking of Dr. Schooley, we've got Chip up next, and he is going to be presenting to us an update about the COVID situation here, not just on our campus, but actually nationally as well. So Chip, please take it away.
Thanks very much, Andy. I was asked to give a little bit of a context about where we are with the epidemic as we are beginning to accelerate our efforts to come back to our core activities. Because none of what we can do is independent of what's going on around us. The Return to Learn program is one that's set up to risk mitigate in a setting in which we think we can operate safely. It's not one to have us come back when the rest of the world is not ready for us to come back in terms of safety. It's a risk mitigation program. So this is the current map of the globe that we've all become too familiar with from Huckins, showing you next a box that's very important here, and that is that we passed 100,000 cases of COVID-19 in the US yesterday, which is a very upsetting deaths, I'm sorry, not just cases, a very upsetting number to have reached in our country, and one I think we should reflect on. Around the world, obviously, substantial carnage as well, but we are now the leader in this, as this epidemic has moved from China to Europe to the US and now to Latin America, with Brazil being a new hotspot. Next. Now in the US, we are seeing a gradual decline, which is one of the reasons why we're talking about returning to learning and returning to research and the activities we've been discussing over the course of the last month and a half. Next, in California, we're seeing what amounts to a plateau that began at a very low level and never reached the high peak that then facilitates the rapid decline that we've seen, for example, in New York, that's driving some of the apparent stability in the US. But we are at a stage in California that we can begin to think about coming back. Next. San Diego is having about 100 to 140 cases a day, ranging to as few as 50 and as high as 145, 147 over the course of the last 6 weeks, and hasn't changed much. Some of this is because of additional testing, but next. Much of it is from an outbreak that is accelerating in the south part of the county, and unfortunately a spillover from Tijuana, which is suffering a tragic explosion of cases that has been accelerating over the last month. Tijuana now is having an epidemic that's not unlike what New York saw a month ago, with Tijuana General Hospital now being all COVID related. It's a humanitarian tragedy in Tijuana, but it's also driving a fair amount of the epidemic in San Diego, and something that makes it clear yet again that we are part of one big metropolis rather than two separate cities. Next slide. Reflecting that, on the right you can see on the right, yes, you can see where the patients who've been at UC San Diego Health with COVID have lived. And you can see that kind of looking at the map, most of it is a lot of it's from central San Diego, some from the south. But if you look to the people who are in the hospital now, reflecting the more recent part of the epidemic, there's a disproportionate spread to the south and to the east, with a big hotspot down across the border from Calexico and Mexicali, where over the weekend, the outbreak spilled over into Southern California, and at one point required us to ship respirators to support hospitals in that region. So one of the driving aspects of the epidemic is clearly south and east, and something we're going to have to take into account as we think about coming back to campus. Next. Now, in terms of coming back to campus, many of you have seen some of the material about this, and a lot of the material has focused on the testing aspect of it. But what I want to emphasize is the testing is really only a small component of it. The most important component of that, last slide, is that this is really an integrated program that includes multiple interactive components, each of which depends on the success of the others. By this, what do I mean? As Chancellor Koszlu was saying, wearing masks is critical. And if we wear masks and reduce the transmission of virus or the shedding of virus among us, we will be able to operate at greater densities than if we have everyone sitting here next to each other not wearing masks. If we look carefully for cases among us and look for viral shedding, then we will have a lower probability of having people who are shedding virus among us. So all of these things fit together in a synergistic way. All are premised on the basis of making it harder for the virus to be transmitted from one person to another, to the point that with each transmission, the virus hits a dead end. And we want this campus to be a dead end, and the only way to do that is to pay attention to all of these aspects of the Return to Learn, Return to Research program. Critically important, paying attention to masking, washing surfaces, and doing all the things that have gotten us to where we are in San Diego, and particularly up here around our campus with some of the numbers you heard from Chancellor Koszlu a few minutes ago. Thanks very much.
So Chip, do you mind taking a few questions if there are some from the audience? Thank you.
Chip, one of the questions that came up is on Return to Learn is why is the Return to Learn program not initially including faculty and staff?
The main reason is an IT related one. We included the students first because they already had medical record numbers that were tied to their student IDs. And to make this work in a non-medical format, and by that I mean in a format in which you don't have to go to the hospital, stand in front of someone who registers you over about a 20-minute period, then hands you a lab slip and goes down the hall. We wanted to set up a system that we could operate now and in the fall, in which we would have swabs that already had barcodes on them that you could just pop with an app on your cell phone and have that swab then be linked to your medical record number without you having to go over and get registered. And we had the logistics set up for that for students, but we don't have that set up yet for faculty and staff. Only about 30% of us get our health care at UC San Diego Health. And so 70% don't have medical records. And we don't have a way of reporting results back from the Calm Lab to medical records for people without records. So it was totally based on that we started with the students. And also because they were here, many of us are not on campus most of the time.
Great, thank you. Another question is, by all indications, San Diego is in a wait mode. If New York is excluded from the national numbers, the cases nationwide would actually be going up and accelerating. Would the prudent approach for UC San Diego be to stay home with remote learning and teaching through the end of the calendar year?
You know, we are putting this in place so that if it looks like we can come back as we get later in the summer, we will be able to. We are not putting this in place to come back regardless of what happens in San Diego or in the rest of the country. It takes a while to be able to put something like this in place. If we were going to do, for example, wide-scale testing on campus, we have to have the swabs. And that's a 3-month supply chain issue. So the fact that we're doing all this planning doesn't mean that we are committed to having people back, whether it's safe or not.
Okay, another question on the return to learn asks, do the models estimate the number of non-UCSD people each student or faculty member contacts? They're thinking of research participants, contractors, community members, etc.
The model that Dr. Martin put together was one in which an individual student or faculty member is seeded as a positive person based on a contact with someone from off the campus. And then based on what we know about the biology of the virus and the epidemiology of it, that virus is passed to other people with a probability based on infectivity and shedding time. So it doesn't matter much whether the virus comes in from a contractor or comes in from a visit from a student to buy shoes at UTC or one of us at Pavilions. It's an event that brings the virus to the campus.
That seems to be all the questions we have specific to return to learn. So Sandy, I think we can move on.
Very good. Thank you, Dr. Schooley. It's really useful to understand what we're trying to do in research in the broader context of this risk mitigation plan that the university as a whole is maintaining. Thank you so much, Chip.
Welcome.
Okay. So our research ramp up planning. The plan that we have that is really a reflection of a large number of faculty, staff, and student input from across campus is a risk mitigation plan as we slowly ramp up activity. It's a phased approach. At this point, we will move to and what we will be calling the orange phase when we can officially start that. Our goal is to start that on Monday, up to 25%. Doesn't mean Monday we'll have 25% of people on campus. It simply means that over the course of the next few weeks, we can get up to that point if we are managing the process whereby individuals are coming back to campus with the safety and health considerations that we're going to be reviewing here. I want to remind everyone that there's a value to continuing off-site work. to the extent that, that work can be done remotely, that means other individuals who actually need to be on campus to conduct their work can be here to do that. And so any work that can be done off campus, we really encourage you to have your staff continue to do that. And again, our growth on campus will be gradual. It will continue to be contingent on the CDC guidelines, the state guidelines, the county public health guidelines, and the requirements that we have on campus as a whole to seek to maintain this as a safer environment. We know that the transmission risks are going to vary with the type of research that people do, who they're in contact with, and also where the research is conducted. And so for that reason, we know not all research will be able to start right now, because at present we may not be able to manage the risks that that are present at right now. So the plan talks about which type of activity can continue and also how to continue that activity. If I could have the next slide, please. Many of you should be familiar with this. It is on the Blink website. These are the 4 phases of our plan to return to work. It parallels the state 4-phase approach. We're in the red phase now. That is, we're still in the shelter at home and transitioning to the stage 2 or the orange phase. We will have, when we officially go to the orange phase, there will be a campus-wide announcement. And so once that announcement comes out, it's at that point that we can begin to return to campus according to the plans that you've submitted. This table shows, and you'll see on the website, the requirements for each of these phases. For example, the PPE, particularly masking on campus, the distancing minimum of 6 feet, and sanitation protocols in every setting. As I said, if people can continue to work remotely, they'll do that. And we want to pay particular attention to the vulnerable groups that we're bringing back on campus, which reminds me to say that if someone is uncomfortable coming back to campus, and this is particularly true for undergrads, grads, and postdocs, no one should be required to come back. And we can have discussions about that. In wet labs, the committee has determined, based on your input, about, at this point, what's safe is about 1 person per aisle. In open rooms, it's about 1 person per 250 square feet. Some of us don't have offices that large. And so it is 1 person per office in that case. So researchers on campus, the lead researcher in each of the units, it submits a plan that covers all of these types of things. And we will have the opportunity at the end of this town hall to go over that process in detail for those who would like to stay and review that. The plan, your plan, is submitted to your department chair, or if you're in health sciences, it would be to your division head, and it is reviewed. It's reviewed for the standards of PPE and sanitation and physical distancing, and any exceptions that you might be requesting for that. It's also looked at in terms of coordination. We know not everybody can come back. There's much research that won't be able to be conducted at this time. That'll have to wait for the yellow phase. And so the department chair will look at that. Once that's reviewed and once it's approved, might come back to you for additional information, it moves on to the dean, or in the case of health sciences, it moves to the department chair from the division head. Again, they're going to be looking at how does this fit overall? Are we still within that cap of 25%? And does it make sense in terms of the building use? Do we have an overabundance of individuals in certain buildings that would increase our risk of transmission? So once that's done, and we see they forward the approved plans to us, you would be eligible to continue. There are a number of things that you need to do before you bring your staff back on, but I want to remind you that this is a dynamic process, that as we move into the orange phase, we're going to be bringing people back onto campus. But if the county says there is a new outbreak of the coronavirus, we would need to retract our participation on site, just as there would be changes for all residents in San Diego County in terms of their requirements. So I want to remind people it's a dynamic process. We like to take advantage of it when we can, but we have to stand ready to diminish our work as well. Next slide, please. So what is it that's going to be expected of people who will be coming back during this orange phase if you're on campus? Number one, I want to remind people that unlike days of yore when I came into work, even if I wasn't feeling well, it doesn't matter now if you don't feel well. If you are ill, we ask you to stay home. Whether it's the coronavirus or not, certain respiratory illnesses may increase your vulnerability to contracting the virus. And so if you're ill, we want you to stay home. Students and trainees cannot be pressured or coerced to come into work, but we do want those with projects that have deadlines to be prioritized if you can manage that in your research lab. There will be, starting on Monday, a daily symptom screening process. We're going to talk about that in a little bit, where when you're at home, before you come to work, you will fill out the COVID-19 CDC core symptom checklist. Those that report any symptoms, that information goes to the lead researcher in your unit, and you're expected to stay home, and there will be some prescriptions for that. On site, it's the behavioral things that we can do that can help maintain safety in our environment and allow our research to flourish. It's minimizing the density, as we talked about before, of on-site, no more than 25%, 6 feet distance, and arranging schedules in a way so that you don't have everybody on-site at the same time. If you can use shifts, alternating days, those types of things that can help you in getting more of your research conducted. I want to emphasize face masks. It is probably the single thing that we can do to best maintain a safe working environment for our faculty, staff, and students that are coming back on board. And then finally, every work site, in order to be approved, will have to have a sanitation plan for within your research area. There are standard sanitation plans that are carried out, those protocols, centrally by facilities and management, and they've been very progressive about how they're dealing with that. But people in the lab are going to be also responsible at the beginning of each shift, at the end of each shift, and if you're working in a human subjects process project, after every single participant that you see, there'll need to be a sanitation procedure. Next slide, please. So those are the core requirements. And just remember that the types of research that you do might require additional requirements. For example, if you are in a clinical trial and that's being conducted in one of the medical facilities, you will need to adhere to the requirements of those medical facilities. If we're doing human subjects research, not in a hospital, we need to have those research participants screened in advance, just as our staff are going to be screened for the COVID symptoms prior to any face-to-face activity. Also, there are specific standards with regard to travel if you're doing off-site work in the community or in an outdoor setting. And so there are standards with regard to both those contexts and to traveling to get to those contexts. So if your lab can meet those standards, then you may be able to begin to ramp up some of the activity in this phase orange. But if you can't, it may be the case that you need to wait till the yellow phase. And we'll talk about that in a few minutes. Next slide, please. So what are the procedures? As I said before, the PI will, or the lead researcher will review the requirements. It's available on Blink for you all to see. You develop a plan, you submit that plan. It's really important that before that plan is submitted, that every single member of your staff that you plan to bring back on site knows and understands what the contingencies are for your research setting, for your lab, for your context. And when you sign that form, you are verifying that you've had that discussion and those individuals that are going to be on site fully understand and agree to that participation. We also have a mechanism where we'll have some signage to remind people of that when they go into the lab. Okay, next, please. So there will be a self-screening process, and I think we have someone who's going to talk about that, right, Faith?
Yes, absolutely. Terry Winbush or Brett Pollock are the two people I have on tap for that.
Yeah, our Brett or Terry, do you want to say anything about what the screening checklist checker is going to be like?
Yeah, Terry, do you want to kick things off?
Sure. So just to mirror many things that VC Brown stated, this symptom screening checker is based on the guidelines from the CDC and the county on for people who will be needing to return to work in person, right? So this will not be required for personnel who are remaining to work off-site. And this is only for that particular purpose as it relates to the county screening pursuant to the CDC guidance, which has been updated as of today. So we will be updating the information in on the web app to comply with the new information. So this would be something that employees who will be coming in person to work can access before heading into work and then have information right away about whether or not they are cleared to report to work, or if instead they need to contact their supervisor to have a separate conversation because they had one of the symptoms that is outlined in the web app on that given day. But that will guide them for that day's work, and then they need to go back to the screening tool to for their next day of work and so forth until this is no longer a requirement. And so as it relates to the technical aspects of utilizing the screening tool, I'll turn that over to Brett, and then we'll be available for questions as well.
Thanks, Terry. And Brett?
Yeah, thanks very much, Terry. Thanks, Sandy. So as Terry mentioned, the county order has been very fluid. But as of now, it states that we need to provide the ability for staff coming to the campus to self-declare any symptoms that may be attributed to COVID-19. So after some research and due diligence about technical solutions, we elected to go with the solution originally implemented by UCLA Health and UCLA Campus using Qualtrics survey solution. The solution will be deployed both for health and campus, as Sandy mentioned, beginning Monday. Documentation and links for the form will be available on Blink and the Pulse intranet for health staff. So basically, staff will perform a one-time registration indicating who they are and who their supervisor or work lead is. When registering, they can elect to receive daily reminders to fill out the form prior to coming to work each morning. Each day, the staff member will fill out the form indicating whether or not they have any of the symptoms that are leading indicators of COVID-19 per the CDC. If they say no, the form lets them know they are cleared, and an email is sent both to them and their supervisor or work lead. If they say yes, the form tells them to stay home, and their supervisor or work lead is also notified via email. It also provides them kind of additional guidance and instructions on what to do next. And so our goal really is to make this as easy and as flexible as possible based on kind of these, rapidly changing guidelines from the county. And ongoing, we'll be soliciting feedback on an ongoing basis, both for staff and for supervisors, to see how we can refine this and make it as easy as possible while still adhering to the guidelines.
Excellent. Thank you so much, Brett. It's really wonderful for us to have this resource to be able to do it online like this. You can do it at home so that you don't come to campus with any of the symptoms. You're actually at home and you get the go ahead if you're symptom free for that day. Thanks so much. In addition to that, we have some environment, health, and safety measures that are taken, as shown in the next slide. I think we can go to the next slide because thank you very much. That EH&S offers helps with a particular checklist. This is for everyone across campus. So I think we have Lance and Steve online who can walk us through the checklist that each research unit director needs to complete.
Is Lance or Stephen Jackson on?
I see Steve. Steve, you need to unmute yourself if you want to kind of walk us through the checklist for the research areas.
Yeah, this is Lance. I'll jump in and try to walk through the checklist a little bit here, which is basically it's just designed to give some guidance on what we need to do to get the research activities ramped back up. We got to complete the tool. We need to train the staff on the face covering requirements, and it's ever changing, just like we've been discussing. It's changing day to day on guidance for face covering, symptom reporting, and how to deal with the COVID aspects. And Cal OSHA is starting to weigh in on putting some additional requirements. It's going to be critical that we inform the staff of the plans, that they're aware of the plans and how that all gets communicated. And then to make it to where it works for the campus, signage on entryway doors, building locations, entrances to conference rooms on how we're maintaining space and doing that. So we've tried to develop the checklist to just walk you through the guidance. EH&S is here to support that, answer questions, and help with anything that's needed throughout the process.
Excellent. Thank you, Lance. And I understand that there may be a few cases where people might have challenges or wonder whether there's a way to accommodate work that they'd like to do in the lab and still have a modified protocol. An example might be someone has a type of instrumentation that takes 2 people to work on it. Could you just share with the folks online what they should do in that case?
Yeah, it's flowing through the research application where they're going to request an exemption to the current policy, social distancing, and that. Once they submit that request for the exemption, it's coming to EH&S to do a review of it. We're going to dive into what is the work. Is it critical for the orange phase? Could it maybe be moved to the yellow? What additional PPE, health screening? What can we do to help accommodate this while we're still maintaining the social distancing and limiting the spread in our research areas? We really want to ensure that we don't have a ramp up in COVID positives within our research space. It's just going to send us back down to the red zone and shut down research for a while.
Yeah. Thank you so much. And EH&S is available for consultation with regard to your plans. I just want to reinforce that notion that every person who comes on campus needs to know and understand what the new protocol is, the way we're going to operate in this orange phase. And so that may mean doing some things differently than we have in the past, in addition to the social distancing and wearing masks, et cetera. In the next slide, I wondered if we could, either Lance or Steve might just comment about public spaces, what researchers can expect about those common areas, in the buildings in which they work.
Yes, I can comment. Can you hear me? CC Brown?
Absolutely. Yes. Thank you, Steve.
Okay, great. Thanks. Yes. And I'd like to refer everybody to the FM Facilities Management website where you can see all the information I'm about to relay. But at this time, with all of the common spaces and with the restrooms, as well as trying to maintain the sanitation for all high touch point areas, FM will be doing that cleaning on a daily basis, and for the high volume restrooms, those will be getting cleaned at a higher frequency. We're also looking at this time, for investing in equipment that will enable, kind of as a force multiplier for our staff, to clean those areas on a more frequent basis, looking at twice and even 3 times a day. But we're still in the beta testing on that phase, or on that stage as far as the cleaning in those spaces. We're also trying to invest in measures for, include to allow folks to kind of self-sanitize or provide self-hygiening measures, such as the installment of hand sanitizing stations at the the exits or the entrances of all buildings for folks to use. And we're also looking at how we can make our buildings as hands-free an environment as possible in order to access the building and kind of maneuver your way through the building as well. So we're looking at automatic door openers and ways that we can provide for access in and out of restrooms, as an example, in as hands-free a manner as possible. And we're also including signage to help educate and make folks aware of what's available and what they should be doing. Again, these are the measures I know Lance talked about, and they're required through the the county and the CDC in terms of the face coverings, the maintaining social distancing, and then the self-hygiene, washing your hands, and those type of measures. So those are also being installed, as well as one last thing, the elevator occupancy. We've put signs up across the campus limiting the occupancy to 1 person per elevator ride. So and again, as those guidelines change or are added to, we will look to stay on top of that by putting the most up-to-date information out as possible. Thanks.
Thank you so much, Stephen. I also want to thank Facilities and Management for the work that they've done to change the filters in the air system to help to assist in collecting any of the ambient virus that may be circulating. And just to remind people that the lead researcher for each unit, in order to get approved, needs to develop one of these signs for outside the door for the unit that they oversee, that says who's responsible, what the room is, and the maximum number of people that can be in there that are approved on the plan at any time, and then what kinds of safety precautions need to be taken, and the sanitization processes. While we encourage people to, we are in this as a team, we also do encourage people to to share with one another and encourage one another to adhere to the standards at your site. And we'll talk about that in a minute, but we also have a hotline in case that you have a concern that you're not comfortable with talking with someone about, and would like to share a notice or a concern, and then we'll have follow-up to that. Next slide, please. Thank you so much. Okay, so we've talked about PPE, what we need to wear, but we need to have it available. And also labs need certain types of materials delivered to them. And I think we have Ted Johnson with us today. We're fortunate. Thank you for being here, Ted, to talk a little bit about how people in fact get the PPE and how lab deliveries will be managed.
Yeah, thank you. Yeah, I guess the good news is that we do have a central receiving and distribution model here at UCSD, which is quite unique. So during the entire shutdown phase, we have been active in delivering products to the campus, to those labs that have been active or needed products delivered. So, I'm happy to say that, for the most part, we've been delivering on an ongoing basis. And in the case that a lab was unable to receive supplies, we had a facility where we could store it. And so at this point, we're going to start re-delivering or delivering the products that we were unable to deliver. There's a little bit of a backlog, but I think we're going to be able to take care of that pretty quickly. And then at the same time, we're going to be integrating the new orders for the campus into the delivery scheme. So I don't anticipate a significant backlog as we have been delivering all along. The second point is PPE. So there was one question that came through that I saw people ordering things in Marketplace or not being able to order them in Marketplace. We found that still a fairly decent number of items have been on allocation and are still allocated. So the items can be ordered through Marketplace. In most cases, the suppliers will not ship them because they're currently allocating them. So what we did is we worked with Research Affairs and Facilities and the EOC, and we were able to buy some large quantities of items that we are going to stock in our warehouse at Trade Street. I'm very happy we were able to do that because I'm speaking with many of my colleagues who are still having trouble getting basic things like gloves and PPEs, masks. Gloves happen to be in really short supply right now. And so I think our quick action allowed us to accumulate a quantity that is going to allow us to open up a research. And so there's a certain portion of that quantity that's going to be distributed to the labs for the initial supply, the welcome kit. And then we have an additional quantity that you will order through Marketplace and will be fulfilled through our internal Trade Street warehouse. So you don't need to really go directly to the suppliers at this time. And depending on how things go, we might start keeping an ongoing inventory of these items to distribute so we're never in a short supply situation.
Excellent. Thank you, Ted. And thank you for your foresight to make this feasible for us to begin to bring research activity back to campus so quickly. Really appreciate your efforts. Okay, next slide, please. So there is a lot that will be changing. And for us, the goal is going to be to increase research while not increasing or minimizing any additional risk for the spread of the virus on campus. And if it occurs, to identify those cases quickly and to act quickly. So to do that, it means we all have to work together. I've already mentioned that the leads for each unit have to attest to the fact that they've shared the new contingencies with every one of their staff, and the staff that they're bringing back onto campus agree to adhere to that. Reminders for those by way of those signs that are going to be posted on everyone's door. And the question really becomes, if you're working in a lab, what do you do if someone's not wearing their mask or they consistently bump into you rather than maintaining that 6-foot distance? Well, if you're comfortable, you can say something to the person because, of course, they're your partner in this, and you all want to be able to continue the work together. You could share it with the head of your research unit. You could talk to your chair. You could even talk to your dean if you want. But I just want to remind people that we have this anonymous way to report those concerns if you're not comfortable, and not everybody is comfortable. I wouldn't suggest that you challenge anyone that you don't know about any of these behaviors, but rather you just report it and report where it is through this anonymous hotline opportunity that we have, or contact EH&S or our office. And in every case, we're going to be investigating these situations. We'll make sure that the leads for each of the areas knows and understands what the problem is, and the department chairs to help with the support. In cases where it's recurrent or it's serious, then we need to have EH&S come and take a look at the safety, the sanitation of the environment. That means people would be asked to leave the lab. They would have to do that assessment, and if they need to do a deep cleaning or a decontamination, they would have to carry out that protocol. So minimally, it would mean moving people off site for a day or two, or even more if necessary, depending on the nature of the infraction. But I just wanted people to know and be alert to this, that by working together on it, we can keep all the labs open, and that's really the goal. So next slide, please. Last thing I wanted to do was just to thank everyone who's been involved. We've had this research continuity task force, just as there's an academic continuity task force, and there's a staffing continuity task force. In every case, there have been a myriad of individuals involved: faculty, staff, students from all across campus, involvement with the academic senate, and important coordinating meetings. So for example, members of the academic continuity task force have been on our research continuity task force. Members of the staffing continuity task force have been members on a research continuity task force. And what this allows is for all across campus, as we start to bring administrative staff back, as we're bringing our researchers back, and ultimately when and how we're able to bring students back, we're all using the same system, the same framework. I especially want to call out individuals who are especially helpful for us in looking at some of the health and safety considerations in wet labs, in situations that involve certain types of instrumentation, and in dry labs, those in clinical trials, and human research that's not clinical trials. Animal research, whole different field, new different requirements there, and we've had lots of input there. Field research as well, and performing and visual arts as well, and also our library facilities. So in every one of these circumstances, not only has this committee headed by Miroslav Kristic and Jim McKerrow, Miroslav, the Senior Associate Vice Chancellor in Research Affairs, and Jim McKerrow, the Dean for Pharmacy, under their leadership, they have solicited input from many individuals, and then after we established the plans, we got additional feedback from students, from staff, from faculty, and many of these other groups as well. So I want to say thank you to all of you, because you are making the plan and you are making it work. So with that, I think this would be a good place to stop. I noticed that we've managed to acquire a number of questions as we go along, and I am hopeful we can take some of these questions now, and depending on how many we get through, we can also have an additional little tutorial video and tutorial for those of you who would like it at the end of our session. So with that, let me start taking some of the questions. And
so Sandy, I'm going to answer one question that has occurred repeatedly, and that'll knock off about 10 of the questions in the queue. Okay. Many people love the sign template that you showed and are asking where they can get it. And I just want everybody to know that that template will be available on the Research Ramp Up website later this afternoon. So we are now down from 140 questions to 130. The other question that has been repeated, and I want to make sure that people hear so that we get to it, is a question for Ted. Just to reiterate, how and when will the initial PPE packet be delivered? And how do we order PPE from the UCSD stockpile rather than from suppliers directly? I think people want to just hear that one more time.
So we're currently working in Marketplace to establish the protocol for the ongoing delivery of PPE, and I think that's going to be advertised. I know an initial communication went out yesterday, but we'll confirm what the exact process is. And I believe there's also a link included in this presentation that directs people to get the initial kit delivered. Is that correct?
Yes.
Yes, that's correct. And also on our website. So on Blink. So the opportunity is there and available for you. Thank you so much, Ted. Appreciate your help.
Sure.
Finally, one more question that I want to throw out because it's been very popular, and I want to throw it out to this august group of panelists before we get there. The apparently people are reading somewhere that 6 feet is no longer the recommended social distancing, that it is 3 feet. Sandy or perhaps Chip, if either of you can comment on that, and will that impact the plans regarding social density that people have made or are making?
Sure. I don't know if Chip is still on with us. Chip, are you available?
Yes.
Excellent. You want to comment on that, please?
So the social distancing issue is more related to people who are not wearing masks and worried about droplet spread. The droplet spread is 6 feet, aerosols go further. So as Dr. Brown said earlier, the most important thing is to nail your mask securely to your face when you come to the campus in the morning.
Yeah, and at present, the county standards expectations are 6 feet. As these change, so will we change on campus. As the science tells us, we can be more liberal. We will move in that direction. I do want to remind people that we need to stay consistent with what the county public health standards are. If we don't, we have to close our research. And so we're going to be very cognizant of these things. And as they change, we'll allow changes on campus, but we can't change before we have that go ahead from the county. So I just want to make that really clear. Good, next question.
Okay, these next few questions are about testing. The first one being, in order to protect research staff members, will UCSD provide COVID-19 tests to human research participants?
Oh, to human research participants.
Yes.
Yeah, I do not think at this point in time we can universally say that. There may be certain types of research, particularly in clinical trials, where that may be a requirement. And if so, then that would unfold. But in general, for human subjects research that is outside of the medical setting and outside of a clinical trial, there is no requirement for testing. And just to remind people, testing tells you the status on one day. A much better approach for us are the behavioral mechanisms that we've been talking about. For human participants, we ask in our research, we ask for symptoms prior to coming. We ask that people are contacted minimally the day before and report for the prior 14 days. And then the morning of an appointment for research participation. And that helps us minimize the risk of bringing the virus onto campus. That combined with, as Dr. Schooley was highlighting, the importance of wearing masks, both for our researchers to wear the masks who are engaged in human research and our participants to wear the masks in the sessions.
Sandy, can I add to that just a little bit? I agree with everything you said.
Yes.
Yeah. So depending on the trial, if it involves hospitalizations through the health system, they have a protocol that does COVID testing depending on the procedure that's happening. In the ACTRI clinic, for prolonged study visits, overnight visits, 4 to 8 hours, maybe I think it's 6 to 8 hours. I'm not exactly sure of the exact number. There is a protocol for doing testing, But for all of the clinical trials, there will be a screening requirement, contacting before the actual in-person study visit. But still, our emphasis on all interactions with research volunteers is to do social distancing, use tools like Zoom, telemedicine whenever possible, and then as a last resort, bringing people in. But for a asymptomatic, healthy research volunteer coming in who screens negative for COVID, we won't be routinely testing for COVID for these folks.
Excellent. Thank you so much, Eric. I appreciate that. And next question, please.
Next question is about testing again. When will antibody testing be available to students, staff, and faculty? Is there an antibody test that is accessible and that is reasonably reliable?
So why don't we start with an answer from Chip, and then maybe I'll chip in.
There are antibody tests that have been reviewed by the FDA under EUA circumstances. The one we have in the hospital is one of those, and they do very well. There are no point of care tests, to my knowledge, that have yet been put through this. By that, I mean the lateral flow sorts of assays that we've used for HIV testing, for example, for a number of years. But I'm sure they will be coming. The antibody tests have more utility at this point in looking at epidemiology related to the number of subclinical cases in a population than they do helping us manage individual people. They don't, some people will have antibodies when they present with symptoms, but most don't. The antibody kinetics are such that most people will have IgG antibodies by 5 or 6 weeks, many earlier than that. And most people retain those IgG antibodies for a number of months and probably longer, although we don't know yet because it's only been a few months the epidemic has been here. We don't yet know whether or not having IgG antibodies prevents you from becoming reinfected. I suspect that at least over the short term with the circulating viruses that we have, that they will. But the only way to know that will be to go to a place like New York, where we think 15 to 20% of people have those antibodies. And when the virus begins to spread again, should it do that, we'll look at a population level and see if people who have those antibodies as pre-existing to the recurrence of virus are less at risk for reinfection. And that's the only real way to know whether they're protective. So right now they are available. They've been used within our healthcare population to get an idea about pre-existing immunity. We have a very low prevalence city and a very low prevalence antibody rate in our healthcare workers. And so I'm pretty sure it extends to most of our faculty and students. Right now, the good tests are available, but they're not widely being used for individual patient management decisions.
Thank you, Chip. Thank you. And Megan?
Okay, another testing question. If someone in the research environment tests positive, what will be the procedure to protect coworkers and further outbreaks other than quarantine?
So let me begin to talk about this, and then I will ask Chip and perhaps others to discuss the contact tracing procedure. I do want to make it very clear that when we identify an individual who tests positive, then we want to do two things. We want to ensure the privacy for that individual to the extent that we can, but we want to alert those in the environment to risk and those who have been in contact with that person. And the campus actually has a very specific protocol for that. And I'd like to have Chip describe in general what that contact tracing process is, unless Cheryl's on, but maybe Chip, you could start.
Are you on, Cheryl? Okay. Cheryl Anderson directs the Department of Family Health at this point, and has put together a exposure notification team to begin to do some of this on campus. This is also something that's changing rapidly in terms of our relationship with the county. We had anticipated until yesterday that she would also be doing this process for the county, and that's less clear now. We're trying to get clarification for that. And depending on how that relationship works out, it will either be part of a broader effort or one that's more focused on the campus. It's very important for us to know who is infected on the campus. And one of the holes that I still see in our plan is testing employees who develop symptoms. The plan right now is for them to be sent to their private doctors and to have their private doctors test them. I would like very much to find a way that we can plug this hole so that we have the information and can notify people on campus. The hospital requires people, no matter where they're tested, to tell them if they're found to be positive. I think we need to do the same thing. So this is not meant to be critical. This is meant to say that we have a lot of moving pieces that we're trying to put in place as we go. The more information we have about people who are infected, the more rapidly we can respond to the kinds of suggestions you're making, which I think are extremely important. I would like to see a system in which we could very rapidly offer testing ourselves to anybody with symptoms who is part of the San Diego community, San Diego UCSD community, so that we can act on it quickly and still be working on that.
So I'll just add, Chip, to what you're saying, that we're aggressively working on that plan. And the hope will be that by next week, we'll have very explicit recommendations for those who are testing positive and for the approach to notification so that we can move quickly through a contact tracing process. Totally agree with you. You know, our goal here is to increase research, but not at the cost of substantially increasing risk to those that come onto campus. It's really a risk mitigation approach that we're taking here. Totally agree with you. Good. Anything else we need to say about that before we move on? All right, if not, Megan.
So these next few questions are about the planning for coming back. The first one is, if a PI is operating in the reduced on-site framework in place since March and does not yet have a new plan approved in the new tool, can the PI still operate his or her lab as previously approved?
Actually, Faith, would you like to talk about the process we're recommending there and why we're recommending
Sure.
what we are? Thank you.
Absolutely. So we do need, for people who have been working on site in what is now known as the red phase, we do need those people to submit a form through the new platform, both because we anticipate that you'll be adding people for the orange phase, and because when we approved you for the red phase, the requirements about social distancing, masks, sanitization were not in place, and we do need everyone to be compliant. So we are expecting that all of the folks who were previously approved to be working on site will submit new plans through the new method. Recognizing that we don't want to see you interrupt your research while you're waiting on that, we ask that you continue your work, but complete the approval process no later than the end of next week.
So I want to emphasize the rationale for that is twofold. One, by completing the plan and having it appropriately reviewed, it is important for people to know who are all the folks who are in the building, and for the department chairs and the deans to know and understand that. And by doing that, then there is additional information important to facilities and management with regard to cleaning and sanitization and decontamination if appropriate. So to be able to be eligible for that PPE, you need to have been registered and approved through the system. When we sort of decommissioned things quickly, we did not have the good fortune of having developed a software platform like we have now through Koali that will allow us to scale up to the yellow phase with very minor modifications on your part or scale back to the red phase if that's required. So we really would like and ask every person who heads a lab to be sure that they have submitted their forms. If they have not, then technically they haven't been approved to remain on campus. We realize it's a little extra work now. It will help us with the yellow phase and with the green phase, help you reduce the effort and also make the initial efforts with regard to, or materials with regard to sanitation materials available in your lab and the PPE available to you too. Good question, thank you. Megan?
I'll take care of it. Okay. Sandy, the question is, when we say that the ramp up will occur slowly over the next few weeks, does that mean different buildings or labs will activate at different times?
Well, I think this is a really important question. I'm not imagining that every single person who runs a lab who wants to increase the number of people in that lab has fully completed the process, has discussed with all of their staff members what their requirements will be, has submitted that to their department chair, has had the conversation with the department chair, has had it approved by the department chair, has had it sent to the dean, has had it reviewed by the dean and approved by the dean. And once it's approved, then you're eligible to get these sort of startup packages with sanitation material and automatic PPE. That's a long process. And so I'm expecting that for some people, they may have already completed that, and they are set to go. Or as of tomorrow, they'll order their PPE and they'll be set to go. There are others where over the course of the next few weeks, you'll be working through that process. There certainly are many cases where faculty have said, I'd like to do such and such, and the department chair, a division head, or a dean has said, I'm not sure that this is the right time to do that. Or EH&S has said, this isn't compliant with what the county requires of us at this time. So there is some back and forth there. So my hope would be that over the course of the next few weeks, we'll be able to get up to 25% of research conducted on campus. And Megan?
Let me jump in. The question is, once I've been approved, what do I have to do to come back? I think you've just answered that, but if you want to say more, this is your opportunity.
Okay, so there is, I think just a couple slides back, a reminder of the checklist, right? That you need to be sure that everyone's informed, that people know about what the new protocol is in your office, that you get the PPE that you need, you get the cleaning materials, sanitization materials for your office, so that you have everything in place, so that you can bring your staff back as risk-free an environment. We know we can't make it risk-free, but we want to make it safer, the safest environment that we can, while still ramping up the research. So there are a number of steps to take. This EH&S a ramp-up checklist for research is a good one to take a look at. And when you fill your form out, your application out to return to research, you'll see this at the end. In some labs, there'll be very little to do, and other labs, it'll be really important that you talk through and have a training process for the staff that are going to be in the lab. But we want to make sure you have all the appropriate PPE. People know what to expect in the laboratory, what they're committing to. And if there are staff that you need to have discussions with because perhaps they're in one of these vulnerable groups, or they have personal hesitancy about coming back to the lab. All of these things need to happen, I think, before you bring people back on campus. Finally, we need to have the official go-ahead that we are transitioning to the orange phase. And I'm expecting that within the next day or two, that we'll be able to send out that announcement. But that's the last trigger, is we have to officially be, as a campus, in that orange phase in order for us to bring people back on campus. So we're sort of doing everything that we can to get right to the point, so that when we get that go-ahead, that we will be able to begin to move staff back on campus.
One more question on the same topic. Thank you, Faith, for stepping in to help with those last couple of questions. What is being done in terms of engineering solutions campus-wide? For example, ventilation systems, especially in some of the older buildings.
Oh, this really good questions, and I do want to. I'm going to turn it over to EH&S in a minute, but I also want to mention one thing that we haven't talked about yet that I think is really exciting. And wastewater doesn't usually excite me, I'll be honest, but our campus is doing something very experimental, and that is we're trying to look at the wastewater of individual buildings to be able to test for the presence of the virus. If we can identify that and we know who are in the buildings, then we'll be able to rapidly target particular individuals to identify risks. So unlike general surveillance of lots of asymptomatic people, this is a way to help us get to identify possibly higher risk groups of individuals more rapidly. So I'll take a step back from that. We don't have to talk about wastewater too much, but maybe it would be good for us at this point to hear from Steve or from Lance with regard to ventilation, et cetera.
So, VC Brown, I can speak a little bit to the ventilation, maybe not as much on the engineering side with new construction, but I can tell you what we're doing in our existing buildings in order to improve, air quality and just the ventilation. And again, this information, I welcome folks to visit the FM website, facilities management website, where you can find the information I'm about to share with you. But just to let you know, 90% of our buildings already have what are called minimum efficiency reporting value MERV filters. We have MERV 14 filters, which are on the very high end of that efficiency rating, and they are capable of filtering out a good bit of some of the air quality contaminant that come through. And what we're also doing is, and again, this is a balancing act. It's not great for energy, but we're ramping up our air ventilation, air volume flows to close to 100% in order to better dilute the air that's coming in, to provide to reduce possible disease transmission vectors. Again, we're operating the HVAC systems on a 24/7 basis, as opposed to low occupancy or non-occupancy setting. Again, to improve the circulation, and we're providing 100% outdoor air at all times into our lab spaces, again, increasing the fan speeds. In addition to that, with all of our other utility systems, the domestic water and potable water systems, we've been doing this, during the duration of kind of the shutdown period, of flushing all of the buildings to ensure we don't have, water sitting in the pipes, and so that when folks do return, they should feel confident that water is clean and ready to go.
Excellent.
So yeah.
Thank you so much. Yeah, thank you so much. And I know that there's a lot of detailed information on your website about the specifics. And I want to compliment you on these air filtration issues, because I think there will be researchers who might have a morning and afternoon and an evening shift working in their laboratories. So people will be there perhaps for longer periods of time during the day than they had historically been there. Lance, did you want to add anything to that? And if you do, there you go, you need to be off.
If I can unmute, I can. Yeah, I think Steve hit it. EHS has been working very closely with FM on the ventilation. We were working prior to COVID on wildfire smoke and how to prevent that penetration into the buildings. So we've done the ramp up on the filtrations to address that. Part of the question was older buildings that might not have the full ventilation systems that the newer ones do. EHS will work with FM and review those locations, open windows, anything we can do to get additional airflow is helpful. If not, we could look at some local, the recommendation might be that the department purchase some local small HEPA type filters to help with the indoor air quality in that area. That those are going to kind of be a case by case look at what we can do to improve the situation.
Very good, thank you. And Faith?
Okay, we've had a couple of questions about we discussed the screening app that's being created by the university, and that's great. We've also had questions about the sign in, sign out requirement. Would you like to comment, Sandy?
Yes, this is really building by building specific. There are some buildings that do require sign in or a specific tag process to sign in and sign out. But I want to remind people that we're having the symptom screening that lets us know who is coming onto campus on a given day. And because the researchers have filled out their forms, we know where they're going. And so by and large, we didn't feel that we needed to mandate a sign in and sign out process when we can take that aggregated information and determine who is on campus in a certain building at a certain time in the day based on the plans that have been approved and the screening process. So we wanted to eliminate one extra thing for people to do. That said, there are buildings that automatically require a signing in and signing out process, and we are fully respectful of that. That process would continue. And this is especially true of buildings where particularly sensitive types of research are conducted. So we didn't add an additional mandate about signing in and signing out, but if you had to before, you'll have to this time.
Thank you for the clarification. We've had a number of questions about clinical trials in human subjects, and I'm going to try to sort of squish them into one for Eric and Kip, which the one question is it possible for human subjects or clinical trials to enroll new patients at this time? And where would we find out about particular requirements regarding screening, use of PPE, and other ways to work with human subjects safely?
So,
yeah, so
Eric, why don't you take
the...
Yeah, go ahead. I was just going to say, go ahead.
Sure. So again, just as everything that's been said, we still need a plan that still needs to be approved, that still needs to be submitted. And then the first priority is always, can we do this remotely? Can we maintain social distance? Is in-person visits, are those necessary? In the ramp up documentation on the website, there are a lot of tools, resources available, strategies such as when inviting someone onto campus after you've screened them by phone the day before, having them wait maybe in their parked car before coming in, so we minimize the time they're in the lobby. Again, all of this is emphasizing social distancing, hand washing protocols, PPE. So once you have those plans submitted and they get approved, then you can proceed. I think that addresses the first part of the question. Kip, do you want to add anything from the regulatory side?
No, I don't think there's anything to add there. Just that I know some questions have come up, even though it's addressed in prior IRB guidance, that sort of protective measures, risk mitigation measures do not necessarily need IRB approval. If they are temporary, if they don't substantively interfere with the protocol or create risk in some other way, for example, by missing safety monitoring procedures, things like that.
Thank you so much, gentlemen. I have to say, I appreciate the flexibility of the IRB so that, for example, protocols that were done in person before that are exactly the same and are done remotely can proceed, and with the leads, the PIs informing the IRB. If they're substantially changed, of course, they would need to come back to the IRB for consideration prior to implementation. Appreciate your flexibility there, Kip, in your leadership. And additionally, to Eric's point, I've seen some pretty creative ways of minimizing the amount of time that the staff and the research participant are together, and yet doing things that they need to do on site by having an individual in a secluded room or a secluded area, and essentially having a virtual, a Zoom, a Skype, whatever, ongoing interaction apart from the patient or the research participant for a portion of time. So I've seen really creative solutions, really impressed with that, and appreciate the examples that are provided on the website in the area that relates to clinical trials and human research non-clinical trials. Thank you, guys.
Thank you. And again, pointing people who have questions about clinical trials or IRB, the Research Ramp Up webpage does have a link to where you can find answers to those questions. If you can't find the answer there, please contact HRPP or the Clinical Trials Office. We've had a number of questions about how can people find out the status of their plan, where it is in the system. And as the person most involved with that, let me quickly respond. When your plan has been approved by all of the necessary approvers, you will receive, or actually both you, the PI, and the person who might have submitted it on your behalf will receive an automatic email telling you that it has been approved. And then you know you are ready to go through the process of preparing your lab and waiting for that orange announcement and getting your PPE and all of that. Up until that point, it is not possible using the tool for you to find out the status of your plan. And so if you have a specific question about the status, you can email us at researchadmin@ucsd.edu. I will tell you, if you submitted your plan an hour ago, don't email us about the status, because the time we spend addressing those questions is going to be time we're not able to address the quirks of the system when they're pointed out to us. So give it 24 to 48 hours before you start worrying about the fact that it might have gotten lost in the system somewhere. Yeah, go ahead.
I was just going to say it is just about 2 o'clock, and so I'd like to mention two things before we close today. One is that when we are done with this formal question and answer period, we will show the video that leads people through the application process, so that those of you who haven't filled the application out yet but would like to have a mini tutorial on that. The video, I think, is 5 minutes, and we'll have some question answer with Faith and others online with regard to that. That'll be available to you in just a moment or two. The other thing I'd like to say is that we know that we haven't gotten through all of the questions, but we appreciate the importance of these questions. And so to that end, we will be answering all the questions, and we'll do that online, and we'll hold that on Blink to have that available to you so that any questions you have now can be answered in a relatively short period of time. The other thing I'd like to say is that just given the interest in having the opportunity to have this discussion, I had been holding town halls about every 3 weeks. I think now would be a really good time as we start to have the experience of just about coming back onto campus or coming back onto campus. There'll be new challenges. We haven't worked out all the kinks yet. There'll be things that we identify, and it would be good for us to have another town hall in the very near future. We'll see if we can get it scheduled next week, and if not, it would be at the beginning of the following week. So I want to thank you all for taking time to participate today. I want to thank those leaders, coordinators, and individuals who've been involved in developing our plan and the logistics of this. We're very pleased that UC San Diego is in the place that it's at. We're not perfect, but we've got a relatively comprehensive, robust plan. And the things that we haven't answered yet, we want to know about those issues, and we want to help you be able to do research on campus if it's permissible within this 25% cap and within the county framework in which we need to operate. So I want to thank you all for your help and your assistance. Those who would like to stay online and see the little video and that is essentially a tutorial for completion of your plan, your research plan for your unit, we'll do that now. And the rest of you, just thank you for joining us. Bye now.
Thank you. So we're starting the video now, and then we'll take questions.
COVID-19 has significantly impacted members of the UC San Diego community. However, UC San Diego is supporting the return to research through the Research and On-Site Activity Reporting platform. To begin, go to the Research Ramp-Up Guidance page in Blink. Here, you will find information for your review prior to completing the Research and On-Site Activity form. Once you have reviewed the safety requirements needed for completing the online plan, scroll down to Quick Links and click on Research and On-Site Activity form, which will open the tool to the Overview section. The Overview section is where you will find critical information needed for submitting the Return to Research Activity plan. Before starting the form, please be sure to review the Research Ramp-Up Guidebook for guidance and resources, which can be found by clicking the hyperlink or visiting the Research Ramp-Up Guidance page in Blink. Download and save the required forms from the guidebook. Ensure you download the forms and save them to your device before filling them out, as attempting to complete the forms in a web browser may result in unsaved information. Downloaded and completed forms can be uploaded in the attachments section of the form. To navigate, use Pages on the left hand to access different sections. The form is dynamic, which means that new sections may appear according to your answers. You can use the action buttons on the right-hand side to navigate through the forms, to save, submit, or discard the form. Saved forms can be accessed by going to the action list. However, discarded forms will be deleted without saving the information. Note that once a form is submitted, no further changes can be made unless the form has been sent back by an approver. Let's walk through a form. Begin by entering the PI information. If the PI or faculty has a joint appointment, is overseeing a program that reports to a unit other than their own, or has a lab housed in a building under the authority of another unit, select Yes to add an additional reviewer. Selecting Yes will add an additional review section, which will appear and will require you to enter the applicable academic reviewers. Next, select the PI's VC area and the applicable academic reviewers. If you are in a unit on the main campus other than an ORU that reports to the Vice Chancellor for Research, you are in Academic Affairs. If you are in the Design Lab, HDSI, QI, or SDSC, you are in Academic Affairs. Click Next to navigate to the Lab Research Group Information section. The Lab Research Group Information section is where you will enter information from your Ramp-Up Staff Framework. Complete the fields accordingly. If you cannot find a type of activity, building, or person, use the Other fields provided to enter the relevant information. If you oversee work in multiple locations, you will need to add each location and personnel by selecting Yes when asked to add an additional lab research group. A lab research group should be added for each location. Up to 5 lab sites can be added. If no other sites are required, select No and move on to the next section. It is highly recommended to enter all personnel for all phases associated with each site. Remember, classifying an individual as green does not imply that the individual is non-essential. It merely indicates that on-site access is not essential to that individual's work. Guidance on campus phases can be found by hovering over the question mark icon. In the attachment section, upload completed documents to the appropriate area. Upload the saved and completed ramp-up staff framework and the social distancing and sanitation protocol. The alternative risk management plan is only required if the standard safety requirements cannot be met for a research area. Once all sections of the form have been filled out and all attachments have been uploaded, submit the form and the notification will be sent to the PI for review and approval. If you save the form and want to access it later, go to your action list. Information and guidance can be found on the Research Ramp-Up Guidance page in Blink and in the Overview section of the form. In-tool guidance is also available through UCSD WalkMe extension. For additional assistance, contact UC San Diego Quality Client Support at 858-534-9979 or email researchadmin@ucsd.edu.
Thank you. So surprisingly, I still see 300 people online, and great to have you. I'm happy to answer questions. Let me just, while we are waiting for questions, and if you can put them in the Q&A box, that would be really helpful. A couple of additional points to make. First of all, if you go to the to that research site where you start the process, and you save a form because you're working midstream. If you go back to that same site, the system is built to start you a new form, and you will think that it hasn't saved your material. It's really important instead to go to the action list. The link for that is available on our website, and if I had been more prepared, I would have had it here to share with you. While we're talking, I will try to get that link available to you immediately. One of the questions asked, is this video going to be available on Blink? Absolutely. We're going to upload that later today. Another question that I'm seeing in the site is, if you do not intend to have anyone return during the orange phase, is it okay to wait to fill out the form until later? As long as you don't intend to have anybody return to on-site work, you don't need to fill out the form. But if people are on site because they were active during the red phase, or they're intending to come back on site during the orange phase, they do need to have the form filled out. And one of the reasons we recommend, if you can, to use the staff ramp-up framework spreadsheet to think about all of your employees and staff, not just the ones who are coming back in orange, is you can do it once for all phases, and it'll also help you move easily between phases if we're required to do so. On other questions, does this form apply only to offices on campus or also to those that are off-site? If you are in working in a facility that is off-site but owned by UCSD, you need to, or rented on your behalf by UCSD, then this process applies. We need to make sure that UCSD employees are safe. If you are working in the office of a partner of ours, such as the Salk Institute, you would be subject to their guidance and you would not need to fill out a separate form. Another question that's been asked is, if I oversee 2 sites, do I have to fill out separate forms? No, you don't. You can start one of these submissions and it allows you to fill out 1 page of information related to one of your locations. And then at the bottom of that page, you click, I have another form to fill out, and it will allow you to submit information about the second site that you oversee. Looking for any other questions? The link to the action list, I am saved by Nicole Joyce. It is in the Q&A. It is, we will try to read it out, but it is UCSD-WalkMe apps.qualico/app/builder/number sign/actions. Not very helpful, I know, but look in the Q&A and you will find it. The question about where the online research form is on Blink, if you go to the research ramp up page, which is on Blink, and it is blink.ucsd.edu/research, you will see a link there to COVID-19 research ramp up guidance. And on that page, at the very top of the forms, resources, quick links, the very first quick link is a link to that research activity platform. And immediately below that is a link to the research action list so that you can go back to the process. One person asks, how long will the review process for the forms take? My plan is very simple. So shouldn't it happen quickly? The review process requires that your plan is reviewed by both your department chair and your dean. If you're in health sciences, in the School of Medicine, that review is likely to be your division head, if you have a division head, and then your department chair. Or if you're in a department that doesn't have divisions, it'll be the department chair and dean. Either way, there are 2 levels of review, regardless of where you are, and it's going to take time for the plan to get through both of those levels. Our deans, our department chairs, our division heads are literally reviewing hundreds of these plans. And so even the simple ones won't get done immediately. We recommend allowing at least 48 hours before you start getting anxious about the plan having gotten lost in the thread. If someone is approved for phase red, are they automatically approved for the orange, yellow, and green phases? Absolutely. You are able to do that. We do not therefore recommend that in order to sort of pre-approve everybody, you make them all red. Red is really meant for the minimum number of personnel to do the most essential activity in the event of a serious shutdown like we've just been in. So really take your time to think about who do you need on campus in each phase, remembering those caps about space available in the facility and about overall personal density caps. I've been asked by somebody that the form was submitted and I received confirmation it had been submitted a week ago. How can you check the status of the application? Unfortunately, you can't do that. We have to do it for you. If more than 2 or 3 days has gone by without word, please send an email to researchadmin@ucsd.edu and we will look into it to see what is going on. I've had a number of questions from people about how to handle it when they can't follow the standard rules. For instance, they're running an MRI or they're in closer proximity to people because they have to train them. In that instance, in addition to the 2 standard required forms, which are the staff research framework and the social distancing and sanitization protocol, you also need to upload an alternative risk management plan. That will be reviewed by your department chair and dean for the scientific merit of needing to do this work but not being able to follow the requirements. And it will be reviewed by EHS to make sure that the plans you have to mitigate the risk, then that those plans make sense. Somebody asks, if I submit regarding 2 sites in 2 parts of the same form, are all approvals held up until all parts are approved? Yes, that is the case. The people are looking at both of your sites together as they look at it. We haven't actually had any examples of somebody saying, I agree with what they're planning in building A, but not in building B. So I'm not sure that is a concern that we really need to have. Some folks have expressed that they can't find certain employees in the list of employees when you're asked to indicate. We have pulled the list from the Active Directory, and there are a few people who are UC San Diego affiliated but are not in the Active Directory for whatever reason. There is a space in the form where you can kind of ignore the drop down and under other role, enter the name and email address of the person that you can't find in the listing. We will actually verify that that person is in fact affiliated with UCSD and not your great aunt Tilly. But once we've confirmed that it's not your great aunt Tilly and is actually a UCSD affiliate, you'll be good to go. We've also had some question about kinks in the system, and yes, there have been some. In order to get you all back to work quickly, we ramped up this system with great speed, and we didn't have as much time to test it as we would have liked. We are constantly making upgrades to the system, but be aware, if you started your form before we made an upgrade to the form, you actually don't get retroactively into that. And so if you are finding yourself in the land of kinks, I do recommend starting a new form, because you will then have the one that we've erased the bugs from. And so that is my recommendation there. People are asking about students in the plan. Yes, you should include in your personnel the students, whether they're graduate students or undergraduate students. If you plan to have those people working in your facility during the orange phase, they need to be listed. A reminder that students cannot be required to return to campus during the orange phase. What we want to do is encourage them and support them in their efforts to meet their educational requirements. So if they're working on a thesis, if they're working on a research project, things like that require them to be on campus, we hope you'll support them. But they do count towards the social distancing and density caps. So you can't simply say, well, I've got social distance on my staff, but I'm not paying attention to it for my students. You do need to factor that in as you are working on your planning for those students. Somebody asks about the return to research initial supplies form. There's a place on the app in the attachments where you can upload it. If you happen to be working in a version of the app that doesn't have that, attach it as one of the optional attachments, and we'll make sure it gets to EOC. Let me check any other questions. Should you submit separate alternative risk management plans for each different aspect? This seems to be related to human subjects. I think that if the aspects are significantly different, like here's something related to imaging work, and here's another problem related to taking physical measurements of somebody, you're probably going to use different strategies to address safety in those different situations. And then I would upload different alternative risk management plans. And that way, when people have questions, they'll be directing the questions to you about the specific area that they're unclear about. Another question, our field group staff is used by several PIs. Can we use one spreadsheet for staff who serve all the PIs, or do we have to submit separate spreadsheets and PIs for each PI? I think that where personnel are shared by multiple staff, for me, the operative question would be, are they supervised by people in different departments or different locations? If the PIs are collaborating together, we certainly don't want the staff to be listed multiple times, but we want to know who's making sure that they're being kept safe. Sandy, I want to make sure that I'm not misrepresenting that. So if you have a cautionary note on that particularly point, I'd love for you to clarify it.
If it is a group of researchers working together on multiple projects with shared staff, I think that it would be fine to have a single designated responsible party who is going to be the one that's going to be doing the coordination for this information. As Faith was saying, if you were to list these individuals independently for multiple projects, each one in each project would count as one person, and you probably don't want that. So it's best to work together and to discuss how to present that information in a way that it accurately reflects the operational patterns of the research program.
Thank you, Sandy. Another question we've gotten is expressing the legitimate frustration about having lots of employees and having to list them individually. that is admittedly work that is boring and frustrating to have to do. However, we do need you to do it. And the reason for that is this. If we are asked because of exposure in a building, if we are asked, can you identify all the people in that building who might have been exposed? If the information about those people is contained in an attachment to your plan, I won't be able to answer that question. And so one of the reasons that we require that after you have filled out your Excel spreadsheet, your staff framework, that you go in and just transfer that information to the online tool, is so that we have data that is actionable when it needs to be, when action needs to be taken. In the March version, we didn't do that, and we did find ourselves in a number of situations where we had really important action that had to be taken, but it took us a long time to gather the information that was required in order to protect our employees and our community. So that's the reason for that requirement. Somebody asks if I've submitted my ramp-up form, but now I know I need to either make a change or add something that I didn't have. How can I do that? Please email researchadmin@ucsd.edu and tell them that you need to do this. What we will do is we will send the form back to the submitter. That may be you, it may be your research assistant, and that person will have the opportunity to edit what they entered earlier and to upload new forms. Once that's happened, it does have to go back through the process of approval. If your addition is simply that you want to submit the supplies form, which doesn't need approval, let us know. We can attach that for you without sending things back to the beginning. So we can attach things that don't require approval. But if you're making any change in your space allocation, your safety planning, or your risk mitigation plan, that we need to know about it, and it needs to go back to the beginning for approval. Is there, I'm going to wait a couple minutes to see if there are any other questions that people might have. I think I've gotten most of them, but I don't want.
And again, these are the questions that are focused primarily on the application process itself.
Yes.
We do know that there are other questions that relate to the return to conducting research on campus, and we will answer those separately. And as I said before, we'll have another town hall that maybe would be, since you've had this overview of the process, would be almost exclusively a question and answer period.
I think that makes good sense. We do have one scheduled already for June 18th, Sandy. Is our next scheduled one. If we want to try to move that up, we can talk about scheduling that.
Yeah, I do. I want to make sure that those that need an opportunity to have some of their questions answered, that we can do that quickly. We'll maintain that June 18th date, but we'll probably add one for either next week or the beginning of the following week.
Okay. A couple last questions filtering in. One, if you want to add a new project or experiment in a different building, can you just submit a new form, or do you have to edit the old one? You can do either. And you can either start fresh and just have it be limited to that building, or you can go back into your existing form, which we can send back to you to start up again, and add it. The advantage to adding it to your existing form is that then all your information will be in one place, which is probably important to your dean and your department chair. So we would recommend you go back and edit to the form that already exists. But if that is for some reason not what you want to do, let's say that the two buildings report to different people, then that might be a situation in which you start a new form. Somebody asks if labs have to fill out a business continuity form. The EOC is working with labs and with different facilities on business continuity planning and encourages every organization and unit on campus to do that. There's a question about the phasing. Is there any very general estimate of when we will move to green? I would say not. Phases are entirely shaped by the public health metrics that we're looking at. And since nobody knows what the course of this pandemic is going to be, I think it would be premature for anyone to say, oh, we'll be at green for sure on X date. We don't know what those dates might be. And what we've been told by our public health experts to expect is that it's not likely to be a smooth progression from red to orange to yellow to green. There's a very strong likelihood that we may go from red to orange to yellow and back to orange. It's going to be a little bit uncertain for a while because we really don't know what the progression of the disease is. And our bottom line is always public health and safety. Somebody asks, who would submit for administrative offices not directly part of research that may need to be physically on site? At the moment, we are told that administrative offices do not need to be on site. And so if you need to be physically on site and you are not a research office, the research ramp-up plan does not apply to you. I believe that next week there will be an announcement made or if not next week, the week after, an announcement made about the timeline of bringing other administrative offices back on campus in the weeks and months to come. Sandy, do you have any more information on that?
Yes, and it is the case that the rollout for administrative offices will be occurring in the near future and with guidelines. And I think that the plan is, again, for the contingencies to be similar to the contingencies that you're hearing about for research purposes. So the same county guidelines will apply regardless of what you're doing on campus. So the template that we have here will be the template for administrative positions as well.
Okay, our last question for the day is, any of this relevant to instructional labs, or will that be handled in different ways? In other words, can or should instructional labs use the research ramp-up process? And the answer is no, this is governing research activity. And as Sandy just mentioned with relation to administrative offices, the same thing is true for instructional labs. The educational continuity group is working on planning for that, and information about that will be coming will be coming forward in the next couple of weeks.
And again, it's coordinated with the research ramp-up process as well, so it should look similar. I think there are some interesting ideas about how to best serve students in this time of COVID-19. Okay.
One last point, because somebody has resubmitted a question that I passed over, which is about guidance on safely taking blood samples. My recommendation to you is that you look at the research ramp-up page and at the guidance specific to human subjects research and clinical trials that is there. If you don't see what you need, then I think what you need to do is talk to either the clinical trials office or the human subjects office to see what guidelines they would recommend.
Excellent. So let me close by, again, thanking everyone for participating. I hope this additional time with regard to the specific application process was useful to you. I want to again reiterate that the research the research continuity task force is working with the educational continuity task force and the staffing continuity task force. So many of the things that you saw today will be applicable to those other contexts as well. An example would be the health screening procedure. These same symptoms that are being assessed and the online process for doing that is appropriate if you're in health sciences, whether you have clinical activities or you have research activities. It'll be what we're going to use for the admin staff coming back on board and for educational leaders as well. So, there will be some benefit by trying this out in the research arena, and maybe we'll have the opportunity to improve some of these things. Again, I want to thank you all. I know we have many things that we have still left to go over. We'll try to answer as many as we can. online in just the next day or so, and then we will come back and meet with you again and make a list of those things that seem to be areas where there are patterns of questions. And we'll launch that with that the next time we get together and have the book of the time for questions and answers. Thank you all so much for participating. It's much appreciated. Thank you.
Thank you, everyone.